with another whiteboard video. It's a long time since I've done one, but I have found that coughing cows has been a real questions come up a lot over the last couple of weeks, and particularly this week. So I said, look, instead of trying to answer individual questions, I'll cover coughing cows in a whiteboard video. My thoughts on it, and probably a little bit more than that, a little bit on respiratory disease in cows in general. And I want to start up the top here with this risk scale across the year. You know, we need to start at the very top level of what time of year it is when it comes to respiratory disease in cows. If we look at January and February and cows are indoors and they're calving, there's natural dip in immunity around transition time. We want to limit, but it's there, that will open the door to a lot of pathogens. And remember, like right throughout this, I'm going to be talking about, this is fundamental, that you know, we're always trying to balance immunity and infection pressure. So we're trying to drive up immunity and reduce down infection pressure. And if anything affects immunity, it'll open the door, regardless, you know, sometimes it could be smaller level of any pathogens. And that's the same for mastitis, respiratory disease. So that's a really key thing. And there's lots of stressors on cows. So that's at that timeline. Now, one of the things I saw a lot of respiratory disease in cows, in dairy cows in May, and really what it was when we investigate them, and one of the best things I've ever done was understand production really, I suppose, at herd level, knowing what the output of the herd is and the inputs from an energy perspective, and looking for gaps. And I saw a second gap appearing in a lot of herds, and generally my experience was when that occurred for over 2 weeks, you'd see cows with immunosuppression, and that opened the door to other respiratory agents and other issues like mastitis. And remember, cows are also in heat at that time, where that can be a stressful event and it can lower immunity. You can see mastitis issues and you can see respiratory disease issues at that time in herds. And so, like some of the herds that I saw were doing 28, 30 litres on average. And I worked out UFLs based on what was going into the cows in dry matter and grass and concentrates, and look at output then on UFLs, and seeing that gap, that was significant. As we move in towards the summer, we're into obviously coughing cows right now. Lungworm goes way up the top of the list, but these cases can be incredibly complicated. And lungworm is a big challenge for farms, and increasingly, I'd say it's one of the biggest limiting factors I would have seen over the last number of years, in summers in particular, on some dairy herds. And why is lungworm an issue? Our weather is favourable, certainly that's one thing. Our grazing strategies are favourable, and we're really dosing young stock well, not allowing immunity to develop. And immunity is a key part of it. So lungworms there. We also have tick-borne diseases. They can play a role in this coughing cow syndrome, this milk drop syndrome often. You know, and we tend to talk about coughing cows, but you know, with respiratory disease, obviously it's high temperatures, nasal discharges, milk drops, that would all indicate maybe pneumonia or respiratory conditions are part of the process. Then as you go out in the autumn time, fog fever potentially becomes a risk factor, with more so with individual cows certainly. So respiratory disease in cows is challenging. My artwork certainly hasn't improved, but if you look at the next thing you need to look at is actually look at the cows, and you got to think about, you know, what causes coughing. What are the cows telling us? Are they coughing all the time? Are they coughing at pasture? Is it occasional coughing? Is it one animal? Is it first and second lactation animals? Are they, you know, particularly when they've been jostled in the collecting yard or moving through the parlour and been walking, you've more air going through the lungs, irritation down there, you're going to see more coughing. Again, I keep saying to people, the nose is the gateway to the lungs. You know, is the nose clear with the coughing? Is there a clear discharge? Well, that maybe indicate viral infections. Is there a purulent discharge? Is there bacterial infections? What's the nose and the cows telling us? Because, you know, what causes coughing? And to me as well, I love looking at cows to see where the cough is coming from. Is it a deeper cough? You know, deeper coughs tend to be more related to parasites like lungworm, bacterial infections, and farmers would have seen this with coughing younger stock in sheds. You know, bacterial secondary infections tend to cause a lot more coughing in my experience. Viruses can cause coughing. They tend to affect the upper respiratory system more. They tend to open the door for bacteria. So these cases can be complicated. It can start with lungworms, and then viral and bacterial pathogens come in. So that's really important to look at the animals, see what's, you know, the time of year, look at the animals, look at those things, and you're putting pieces of a jigsaw puzzle together. Other stressors like heat, cows in heat, flies, handling animals, what other stressors, what other factors are there? And if we focus in now on the coughing cow syndrome and lungworm in dairy cows, you know, most farmers look, it'd be straightforward. We can dose our cows, we dose them once or twice a year when they cough, and that works fine, and we're getting a response. But what I'm seeing and what I'm hearing, and of course I'm probably attracted to the more difficult cases from talking to vets, is the coughing is persisting, and we're not getting response to dosing, and the coughing, you know, the dosing's not working. There's some other agents that are quite complicated. So the options are, with coughing always are, and if it's the time of year that we think it is, and it's the most likely differential, we dose with epinephrine. Now the challenge for lactating dairy cows is there's one licensed product for treating lungworm, for worms in general, when animals are lactating. So epinephrine, although there's different forms of Poron or injectable and certain different brands on Poron, it's the same problem. It's the same product. So if we now have a product that we're continually using the same active ingredient all the time, some farms at this stage have dosed 3 times, we're into a situation where we could develop resistance. And I'm going to put my head on the chopping block here, saying that I've done a lot of work on parasites in sheep and cattle and seeing resistance in everything. Even last year in sheep and nematodaris, worm we thought there was no resistance in. Why would lungworm not develop resistance? Now it's difficult to see, so it's probably not sustainable for farms to be using epinephrine repeatedly as just their only control over the summer months, and that's something I'm fairly strong on. Now, when we have these cases, we need to look at the cows and look at the history, but diagnostics does play a role in working with your vet to try and put the pieces of the jigsaw puzzle together. Now, dongs in adult cows when we're chasing lungworm can be unrewarding because of a thing called Reinfection Syndrome, where the larvae, young immature larvae, get to the lungs, don't develop into adults, but can cause all that damage and coughing and irritation. And they won't develop or produce larvae in the dung, which can be difficult. And that's why so many vets are talking about lung washing now, and it's where we put saline sterile fluid down into the lungs to flush back these larvae to see if we got physical evidence. And they've been used reliably. Now the challenge is that they're not the easiest thing in the world to do. You need to do a number of cows, they can cost money, and you can get unrewarding results. But if we're not getting larvae back, we need to think about these cases can be complicated. And you need to look at other factors as well, other parts of the diagnostic arsenal, like bloods. Tick-borne fever is something that we're seeing more of. Farm labs in Roscommon do a blood test for that. I think it's a worth screening. Tick-borne diseases in dairy cows can cause issues in herds, and they can be very hard to determine, very non-specific. You know, it can be soft coughing to temperature drops, to milk temperature increases, milk drops. So ticks are a factor, and they can suppress immunity. They can be another factor for suppressing immunity and open the door for some of these other respiratory pathogens. I find nasal swabs very good, because what nasal swabs are doing, and we're learning about them, is you're going in and you're checking for DNA through PCR of the virus or bacterial agents, and I think they're part of the jigsaw puzzle. Of course, it's said to me time and time again, that takes time, that takes money, but these coughing cows and respiratory syndromes, when you look at them and you look at production again, because production can drop from 1 to 4 litres per cow a day, and over 100 cows over 2 weeks, that runs into significant money. So we don't often factor in the cost of the milk drop and the effects of these diseases on herds. So it is worth sometimes trying to put these pieces of jigsaw puzzle together to get a better idea what's happening. So if you have coughing cows and you're dosing and not getting a response, you must remember that these cases can be complicated. So parasites, if it's still just lungworm and you're getting a poor response, we've got to ask the question, do we have a resistance issue? That's a long-term thing we need to establish on farms. When we're only using one product, there's a Poron injectable, are we using it correctly? Are we using it? A lot of herds here that I saw issues with production and respiratory viral issues were dosing for lungworm here where they didn't need to dose it, and then going on and the problem is getting worse. But so it's about understanding what's happening. So parasites and lungworm, and then we must remember that we can get viral and bacterial agents as well on their own. Any stressor will cause that, like I've seen in these herds or other stressors. But often when lungworm comes, it will open the door. It will cause irritation in the lungs, in the parenchyma down there where they get the oxygen in. And that opens the door for bacteria that are there anyway. There's Menhemia, Histophilus, and you can get proliferation. You get the secondary bacterial infection, which continues the coughing and continues the problem. You'll typically see more discharges, and it can open the door to a lot of these viruses that are circulating as well. And these cases are unfortunately complicated, and that's, I suppose, a key message for me is that we need to put this information, we need to stand back from the herd, look at it at what time of year it is, look at what's potentially happening, and then look at the cows, look carefully there at the cows and see what's happening at herd level, when's the coughing occurring. But diagnostics do play a role. The future for coughing cows and respiratory disease, we're trying to reduce antibiotics, we're trying to reduce anthelmintics. The regulations are going to force that changes. We need to look at young stock, how we manage them and trying to build immunity, certainly with lungworm earlier, and that is a risk where you overdose young stock and they come in naive into the herd. The other thing is if you're contract rearing and you're bringing your heifers to a place where they have no exposure, suddenly they're joining the milking herd and you're getting a lot of lungworm issues. And again, that will be evident at some farms when you look at the coughing, and you'll see actually it's often first lactation animals, second lactation animals that might be doing the most of the coughing in the herd. So it's just something to bear in mind. I know maybe I'm bamboozling people with information here around how complicated it is. It was so simple when we just dosed and moved on and that was it. But these cases, and this is what I'm seeing as the complication. And finally, lungworm vaccination. Because immunity is so important in the lungworm story, I think more and more herds are going to have a discussion with their vet around vaccinating for lungworm and what that means. And it can be a tricky vaccination, but I'm seeing good results with it on farms. It's something that's been used sort of outside of Ireland more so, but I think it's a real strategy that we need to think about for our dairy herds in the future, particularly where you're using epinephrine 3, 4, 5 times a year. And again, I'm seeing it this year. And we need to look at the risks as well around lungworm with young stock. And remember, when it was dry, we saw no issues. The weather that came, flush larvae out of dung pads, out of dung, and that really exposed and increased the risk over the 3 to 4 weeks after that. And we must understand as well in grazing systems, unfortunately, that one simple thing to remember is that if we've got good weather for grass growth, it's good weather for the parasites as well. They like the same conditions, so that is a challenge. So we just need to think about our grazing strategies at a top level, and then work on what's happening with your coughing cows. Obviously you want to get that under control. It's costing you money, it's knocking out production, and it does require that sort of workup. And I hope I haven't spared people with the complication of the coughing and respiratory disease complex in cows, but it is that, unfortunately. It does require that bit of effort. I hope everyone's staying safe and well. That's it. That's the first whiteboard video in a long time for me. A happy, safe farming, everyone.